Hello, I am Dr. Vivekanand Kulkarni, a gastroenterologist from Antarang Hospital, Kolhapur. I am going to talk about constipation. Constipation is a very common problem which affects quality of life. Its incidence is increasing nowadays because of changing lifestyle. People are leading sedentary life. There is no exercise. There is a lack of fiber in the diet, and there is more of a oily and refined food which tastes better. Because of this, the incidence of constipation is increasing. Person with constipation feels that he has got an incomplete evacuation of the stool, and that is why he feels abdominal discomfort. Such persons may pass stools less than 3 times a week. He may pass very hard and lumpy stools. He has to strain excessively while passing stools, or sometimes the person attends the toilet more frequently in an attempt to clear the bowels, but he comes out unsatisfied. Now, occasional constipation that we see after a travel or after a outside food can be treated by correcting the diet, that is increase in the fiber, that is leafy vegetables, salads, fruits, taking plenty of water and doing some exercises and taking 2 or 3 glasses of water before going to motion. We may also take occasional mild laxatives if the constipation persists. But a few people have got a very long standing constipation going in for years together. They have tried many laxatives or they have become dependent on laxatives. Now, in such patients, there can be a very slow movement or motility of the intestine which causes constipation. Few people have got irritable bowel syndrome, which is usually associated with some form of mild anxiety or depression, wherein in spite of passing stools, person feels that he is constipated. In some patients, there is a problem in the process of evacuation of the stool because of the incoordination of the muscles in the anus and distal colon, which is known as obstructed defecation. Now, very long standing constipation requires investigations like stool examination to see if there is any form of swelling in the intestine, colonoscopy, which tells whether there is any obstruction in the colon, or anorectal manometry, which gives information about the muscular coordination which is required for passing stool. But if person has got a recent onset of constipation or there is a change in bowel movements, and if the patient is passing blood or mucus in the stool, if there is a pain in abdomen, if there is anemia or weight loss, that may signify that patient may be having some serious disease, something like tumor or cancer which is obstructing intestine, or there may be diseases like colitis, Crohn's or tuberculosis or diverticulitis, which may cause recent onset of constipation along with the pain or blood and mucus in the stool. This requires immediate serious attention by the doctor. The doctor may do tests like again stool examination, colonoscopy, or imaging tests like sonography or CT scan to know what is the cause of this recent onset of constipation. So, whenever you have a long standing constipation or a recent onset of constipation, with alarming signs as I mentioned above, it is important that you seek doctors advise as early as possible.